Good afternoon and welcome to the Independent Scientific Advocacy Group public meeting. The Independent Scientific Advocacy Group has been arguing for evidence-based response to this global pandemic, and today we are focusing our discussion on the most recent developments, primarily the decisions within Europe, but also specifically, especially in England, to relax restrictions and to anticipate what this means, to discuss, what the right time to do this is. There's been this apparently rhetorical question that has been posed, which is, if not now, when? As if there was no good answer to that. But there is a good answer to that, because there is a better time to relax the restrictions. We all want to get back to a normal life, but we also want to preserve the health of our population and the integrity of our health systems. So we're going to be talking about all of this today, but as usual, to start off, we are going to have a situation update, and today we have Paul Dempsey. Thank you, Paul.
Grant. So Ben, if you can just show up the slides. Next slide. So looking first is the first slide here, that we have the situation in Northern Ireland on a linear scale. So this is what's generally type of thing that's published recently by NEFIT, is the daily average cases per 100,000 population. And we can see here that the situation in Northern Ireland is getting worse, but especially in the younger age group of 20 to 40-year-olds. They haven't had much vaccine in that group yet, but they are accelerating. So hopefully in time that will show. We can even see down the older group in absolute numbers. Now, when we switch to the next slide, we see the situation in the Republic of Ireland. The axis here is different because the situation here is a lot better than in Northern Ireland. We have around half in general, a bit better than that. Again, mainly in one age group, 19 to 24-year-olds. Big growth in the 13 to 18-year-olds. Again, this is on a linear scale, which is what tends to be put out a lot by NEFIT and groups. But for actually looking and trying to figure out what's going on, if we look at the next chart, it's on a logarithmic scale. So what that means is, instead of going up from 1, 2, 3, 4, that way, we count as 1, 2, 4, 8. And the reason we do this is how anything replicates. So a virus will go from one person to 2 people to 4 people to 8 people, and that's how we kind of get to the R number, and that can be different. So that's why we use this scale. It's also on this scale we can see various things. So for example, we can see here that things, when they go exponential on a log scale, they go in a straight line. So we can see here that things are going pretty much in a straight line, and a very similar straight line in all of the age groups. Just what there is a big lag, a time lag between the older age groups and the younger ones. What we can see here, though, is the Republic of Ireland, the overall incidence here, which is around 1,000 cases a day. If the over 80s in Northern Ireland had a population of 4.9 million, which they don't, thankfully, they would be at that kind of level. So their over 80s are about as bad as we are overall. Their population average in the north is about the same as the Republic's highest group, the 19 to 24-year-olds. Just kind of put a kind of a scale on how much worse things are in Northern Ireland right now, and how much testing of a vaccine is going to happen in the next while. So as we can see, if we look across from the black line across to the red line, at one stage there was a 3-week gap in kind of the incidence rates, and that is reduced down to a 2-8. And actually the rate of increase in the older groups is faster than in the younger groups. If we look at the next slide for Republic of Ireland, again, this is on the same scale. So you see that our older groups, are 65 plus, are lower than we have in the Northern Ireland by nearly a factor of 10, which is good for deaths and hospitalisations in the short term. But if we continue these lines up till end of July, early August, and we add up what we'd get, we could be looking at between 2,500 and 3,000 cases a day by the early July if these trends continue. Now there's a few things to look. We can see on the blue line, which is the 13 to 18-year-olds, it kind of switches at a certain point in time. It roughly corresponds to the end of the Leaving Cert, time-wise. Before that, it was following the population average. Another kind of thing that's going off trend is the 0 to 12-year-olds. They were following the population average for a good while, and roughly corresponding with the end of primary school, they've flattened off and have less cases in that group. Again, I suppose one of the big differences in the Republic compared to the North and other places is in our secondary schools we good enough mask wearing. In primary schools we don't, but now that we see that they're no longer indoors as much, they have had this decrease, whereas with the older age groups they're indoors in more or masks. Again, so all of these trends are before we have the impact of imports from this week from holidaymakers returning, or those impacts amplified by the return of indoor dining next week, which will probably impact us in mid-August when we see the full of the impact. On the next information slide, we see just a comparison. So we often compare ourselves to Europe, but we really aren't that similar to even the UK or the EU. The only kind of country in Europe that we're similar to in terms of kind of important things like the average household size, the average age of population, the percent of the population under 65, and also the kind of the death rates pre-2020. We're very close to Cyprus, and back in early June, they introduced a Safe Pass reopening scheme where they were able to do indoor dining on a kind of a pretty much a little bit more liberal than we're talking about, where they were allowing PC testing as well. And we can see that what happened there was nearly exactly when you'd expect it to happen. The cases shot up. Where they are now is about 5,600 cases a day, which is pretty increased. But you can kind of see by the curves there, not too hard to achieve. Again, as I said, we're both very different than the EU and the UK. The big difference between Cyprus and Ireland is we have very good coverage of the vaccine in the older age groups. Like 98, 99%, whereas they haven't reached those type of high levels. So they'll have more consequences in terms of hospitalisations and deaths. But we have poorer coverage in the younger age groups, even though they're slightly ahead overall in vaccination. So they've got more things that will slow down transmission than we do. So, there's lots of uncertainty in all of this. It's no point in predicting anything with exact certainty, but this is a kind of that roughly maps what we could possibly expect in the coming few weeks. If we do get to this stage, just again, it's an if, we look at the next slide and say, how do we get back to something safe before either schools or even Christmas? So getting something, if we do get up to that, getting to safe levels before schools open, even getting back to current levels before schools open will be virtually impossible. I mean, China's best reduction is the green line there. Israel's, which was a very, very strict regime, Israel's was a mixture of controls and vaccine, and they were able to get it down. Our best was, again, would which was last year, would get us down there back down to our current levels just in time for schools. But more recently, what we'll be looking at are the blue lines or the orange lines. That's what tends to happen when we still have lots of inward bound cases where they push up the effective R. And we would be left with a very hard to get down case, even in time for a relatively safe Christmas. We probably need to be looking at 100 cases.
Well. Yep. I just wanted to say, so I just think this is really important to emphasize this here. So you're basically saying, if our numbers go up like they have in Cyprus, what you're showing in that graph is how long it would take us to recover just back to where we are now, not to even get better than now, but just to, if we let things go the way they've gone in Cyprus, which is a potential prospect, then the restrictions and the amount of time it would take to get back down to today's levels, not to better than today, but back to roughly today's levels, we wouldn't be there by back to school time.
It would be really, really difficult to get it back there by back to school time. Now, there's possible reasons why it might not happen. So some of the current rises could have been from, say, gatherings around the soccer finals, and maybe we got a boost from there that might not be a general trend. And there's just so many possibilities that but this is just a kind of looking at the data and just following a straight line without trying to be fancy or do too many kind of assumptions. And again, when we talk about is there a vaccine effect in there, yes, the Israeli example is where there was a vaccine effect plus their restrictions because they wanted to get it down to a manageable number before they reopened, and they were doing okay until they well, they were doing very well until they allowed Delta back in, because they had a vaccine allowance in where they just allowed basically vaccinated but infected people in, and that's how it started off in Israel. And now they're back, but close enough to our level now.
Okay, yeah.
Okay, I think that's the end of this update.
Great.
Thank you.
And Paul as well, you made the comment there that we're testing the vaccine, and I think this is an important point to make. In the fact we've rolled out our vaccine, and now we're testing our vaccine, much like somebody might test their seatbelt by crashing into a tree or something. It's not a good way to. It's not a good way to use your safety measures. So we have our vaccine rolled out now to a lot of people, but there's still many people who have not had the opportunity yet to get the vaccine. So it's for those vaccinated people we're testing it by letting things rip. So they're letting it rip officially in the UK. In Ireland, we haven't said that we're doing that. In fact, Micheál Martin has said we don't want to do that. He's acknowledged the risks of long COVID and how we don't want to let that happen to our young people. But we're maybe passively doing that, in the sense that we're not preventing it from ripping through our population, and taking these steps like we have now. We've got international travel has been opened up significantly in the last couple of weeks. And we're talking about next Monday having indoor hospitality open for, at the moment, it's already open for hotels, but for general hospitality, and allowing children to be present as well. And of course, the staff will be largely unvaccinated. And so taking these steps, although we say we're not letting it rip, it might have the same effect, that it will potentially go through our whole population. We also don't differentiate
here in any of your communications between the impact Pfizer has on transmission versus the impact that AstraZeneca and Janssen have. So they're kind of big differences. Would you just
lay that out for us here, though, Paul? If you could just...
Well, for Delta, the kind of the data is not clear because it's just so new. But for Alpha, when they were looking at it, Pfizer could destroy a transmission of Alpha. It just wouldn't happen. But even if Delta hadn't happened, and once Israel started allowing in vaccinated people without those restrictions that they had on them, if they were going to allow in the AstraZeneca versions, there would have been enough transmission to kickstart it in their youth. But it would have to get in there first, which will happen. And also what we saw happen in the UK. So what's different from here in the UK is the UK's surge happened in school children first, and worked its way up and up into the mainly unvaccinated groups. And then what happens, you get them hitting off the vaccinated people who are generally protected, but there's that margin where you're not. So you're talking about, it was 96% Public Health England said for Pfizer, 92% for AstraZeneca against hospitalisation. So that means, even just from that, you get, so for every one person who's Pfizered who ends up in hospital, you've got 2 people who've got AstraZeneca in the UK will end up in hospital. Depending on who got it, age groups, all that kind of thing. So it's, but you're testing it too much. So if we take what, say, our original worry about the IF4 would be between 0.9 and 1.1% of the for everyone infected would die. Our vaccine's reducing that by 96%. Still leaves you with quite a large death toll, maybe around 2,000 per unmitigated wave. But again, that's something maybe we have to get used to, and that might be the part of living with COVID, is that we have to start to accept that is going to be the annual death or the per wave death toll, and for a while anyway, until it settles in, and then we just hope for the best and hope there's no more variants. I suppose this is the real problem with the international travel right now, is if we accept those 2,000 deaths, then that's okay. The government can say that, and that's an acceptable loss. But then you can worry about what happened in the UK, that they end up generating vaccine escape, in which case it's not 2,000. It may not be back the whole way to original worries, but even a significant jump on that, and we're just back to like August 2020, where we know lots of the medics have told us about things where they're able to reduce the death rate by small treatments. But you're just left with so many hospitalizations that, use numbers, sheer numbers. Even like it's the Dougal thing of cow close, big, cow far away. It's still the same cow. It's just how many it takes to get to.
Smaller. So yeah, and this number of acceptable deaths is never a conversation the government has had openly. Like, have they done this calculation? Have they decided that 2,000 is acceptable? We don't know that. And you mentioned that the one potential spanner in the works of this every time is that we get a new variant that's more difficult to deal with. And if the strategy is hoping that doesn't happen, when it's already happened several times in the space of a year, it seems a pretty foolish strategy, to bank on something not happening that's already happened a few times. It's shown its propensity to occur. So, yeah. But anyway, thank you, Paul. I mean, yeah, sorry.
No, I mean, I wouldn't comment on that. Like, there's other virologists are worried about geneticists or mutation. People there more for that than that. Yeah.
Well, there's quite a number of people who have said that if you wanted to set up an experiment to select for the evolution of a vaccine escape variant, to do what they're doing in England at the moment, you'd have a partially vaccinated population, and then let the virus go through the population. So you could effectively be selecting for the ones that can transmit through the vaccinated people. So let's hope that doesn't happen. But we are kind of watching what's happening in the UK, and we have been, lucky in one respect, because in the UK they have such good genomic surveillance. Some of the best genomic surveillance in the world. They've got really brilliant public health doctors and epidemiologists who've been observing this, recognizing the trends, and warning their own government, but also warning other places. And we've been listening to that, but I don't think the steps that have been taken here really reflect that. And the idea that we're now in such a period of growth of cases, and we're talking about relaxing restrictions on indoor hospitality with yet to be decided or yet to be announced mitigations in terms of ventilation. I mean, and they're talking about doing it for next Monday. I just don't see how that's going to happen. But Gabriel, I was hoping I might bring you in here now, because we are all very interested in what's happening in the UK. There's been a lot of reaction to it. Boris Johnson's kind of let it rip type approach. And maybe you could just give us a few words on that, what you think about it, and maybe just lay it out for the audience so they know really what is happening. Oh, I can't hear Gabriel. Can anybody hear? And Gabriel, I think as well, it's because we've seen these pictures of people going to nightclubs and these kind of things, and I think there's been this celebration in England. I think it's not UK wide, but it looked like a New Year's Eve countdown, as if the pandemic is over. And people might be forgiven for thinking it is. I mean, if they're listening to their leaders and they're telling them, now we can stop wearing masks, we can stop basically all of the restrictions.
I don't think I can. I'm sure the reason my microphone wouldn't let me speak was because I was about to use bad language, and I can't really express my true feelings about this. I think it is. Amazing. I've written something for a magazine called The New Statesman, where I say that I'm completely unaware of any other time in history when a government has actually encouraged the spread of a dangerous infectious disease amongst its population. It is just extraordinary. And the view is that it's much better to have these cases, hospital admissions and deaths now during the summer than it is to have them in the autumn and the winter. And I just find that that's completely against everything I believe in terms of medicine, and everything I believe in terms of public health. Most health professionals spend their life trying to prevent illness and delay death and save people from dying if possible. And the thought that one would actively want that to happen, I think it's just beyond belief. So, which is why the world is watching to see what happens, and it's not going terribly well. The data is produced daily. And yesterday, the 7-day total of deaths have gone up 61%. The admissions have gone up 38%, and cases have gone up 41%. And it's just going like that. And of course, those deaths are reflecting the cases that were in play about 3 weeks ago. So the profile is looking really terrible. And I sit in my office in Bristol, and my own personal monitoring system is the sirens of the ambulances going past. And yesterday, the sirens were back in a way they hadn't been for quite a while. So I think it's a very, very sobering situation we're in, and it's not properly recognised. For example, I am astounded that more countries haven't done anything about travel to the UK. I know the US has. The State Department has put in a do not go to the UK to the whole of to US citizens. And the CDC in Atlanta have warned people, if you go, even if you're doubly vaccinated, you can get infected and get ill.
Yeah.
And I think it's in a remarkable situation. The number of cases in the UK higher than cases in the whole of the west of Europe quite frequently in the last week or two, and sometimes having the highest number of cases reported in a single day in the world. It's just amazing.
Although we're trying to catch up, apparently. So it looks like. But well, Gabriel,
this is one rivalry I wouldn't encourage.
Yes, no. Are you also seeing effects? Because one of the things, so as we know, a lot of people are protected from the most severe outcomes by their vaccines, but that doesn't mean they don't need hospitalization, and doesn't mean they don't need medical attention. So are you seeing the effects yet of the COVID surge putting strain on the provision of other kinds of healthcare? Are you seeing that now already in England? And
well, I think we are. I think we are in all sorts of ways, and they're dealing with this, responding to this in interesting ways as well, because there's so many cases, and the technology, the apps, alert people if they've been close to someone who has just recently tested positive, or if they've been named as a contact, and so on. And people are being pinged, as they say, all the time now, because there's so much more movement and socialization of people and so many cases. So your chances of getting pinged are really quite high. And this is causing real problems to the business community, who this was designed to help, actually, wasn't it? Opening up so that they could get back to business. And some businesses can't open up because they haven't got any staff, because they're in self-isolation. So the government's unique response to this is, well, you don't have to isolate. And if you're in certain groups, and so they're going to exempt NHS people, they're going to exempt electricity people, workers in the water industry and railroads, in food, the food system, and which is, I just think it's ridiculous. The reason that we're having all these pings is because the cases have been allowed to get out of control. Yeah. And one that worries me most in that is healthcare workers. And we know that being doubly vaccinated doesn't protect you completely. It doesn't protect you either from getting the infection or transmitting the infection. And here we are saying it's all right for healthcare workers who've been pinged to go into work, that they're a close contact. And of course, the UK has been extraordinarily off beam in terms of it doesn't test. The UK doesn't test. I know Scotland and Northern Ireland both have said they started doing it within the last couple of months, but England still doesn't test close contacts. The people who are at highest risk are not tested. They're told to self-isolate and only come for testing if and when they develop symptoms. It's crazy when we know that there's so many asymptomatic. So the whole thing is pretty chaotic, and it looks like there's a real determination of the government that we're just going to see this out. And I think a lot of people very, very concerned.
Yeah, and healthcare workers, of course, have been some of the people who've been under the most severe strain throughout this whole pandemic, because they've been the most exposed, but they've also been working under really extraordinary onerous circumstances and just a huge workload. It's been terrible. And this question that was asked by Boris Johnson, if not now, when, it really is presenting these infections as inevitable. It's saying, it's basically, I mean, that's how I understand what he's saying. He's saying these people will get affected, we rather them to get infected in the summer than in the winter when the health system is under strain from other things as well. So it's like, you will get infected, so we've picked now for you. But this is a preventable disease. And we have vaccination, which is an extraordinary aspect of that prevention. But there are also other environmental mitigations that can be done. And we've talked previously about ventilation and masks and these things.
Yeah, and there's nothing like that is happening. There's no attention being paid to ventilation. There's no face masks. We're still in the situation of lots of people still think it's droplet spread, and there's been no attempt. Even when I got my vaccination, I got a little NHS leaflet, which was about droplet spread. Incredible. And we know that the face coverings, which were fairly effective against droplet spread, are not effective against aerosol. Anyone who wears glasses knows that, because your glasses steam up with one of the loose-fitting face coverings. And we really should be doing what some European countries are doing and mandating proper FFP2 or FFP3 mask wearing. So none of that prevention stuff is happening. In fact, most of the things that are being withdrawn. And the point is that why, if not now, when? Well, when we are fully vaccinated, let's get on with the vaccination program. It's still not reaching all parts of the community, and it looks like like many's another vaccination program, it's easy to get it up to 70 or 80% of your target population, but really tough to get it up there to the high 80s or into the 90s. And there are still communities, very big variation in who's taking the vaccine, with some communities and some groups in society not having a big uptake. And the government has also decided not to provide routine immunisation to young people between 12 and 17. Which I find a remarkable decision. They've agreed to do it for some groups of vulnerable kids, but not all of them. And it's very hard to work that out. Many other countries are vaccinating all their young people 12 and over. The US have delivered almost 10 million vaccines into young people in that age group, with very, very few side effects. And we're still seeing large numbers of long COVID. And that whole group of people in the UK, anyway, under the age of 18, make up 21% of the population. So you're never going to have a vaccinated immunity protective effect if we don't do something about children and young people.
Yeah, and the risks of long COVID. I mean, I think the long COVID sounds terrifying, and the idea that we don't give any protection to that younger group, that they will not be allowed to get vaccinated. It won't be made available to them, and we're removing all of the other mitigations. I wanted to bring in some other people now. So maybe Anthony, you might talk a bit about the letter that you drafted this week to send to our own Minister of Health, listing some of the things that we could be doing to actually prevent this. If not now, when? Well, how's never? How's never for you? Never is good for me.
We sent a letter to Minister Donnelly yesterday, and we've put it up on our website this morning, so anyone who wants to is welcome to read it. And what we're saying to the Minister is that what we're actually doing here is not that far from what's being done in England. And certainly from our perspective, not nearly far enough from what's being done in England. I mean, I think Gabriel has outlined very clearly the colossal risk that is being run there. We are doing something similar on a much smaller scale. The government's models, which we would largely agree with, predict very bad outcomes from the current policy. The government has been in discussions with the restaurant trade over the last few weeks, and there's still no clarity about what's going to happen. Adrian Cummings was talking about that on the radio this morning. So we don't really know where we're going, but it's not likely to be to a good place. We have a good vaccination program, but we vaccinated very few people under the age of 18. And at the moment, there is active discussion about whether to vaccinate 12 to 18-year-olds. I hope that NIAC will come off the fence on that within the next week or so. We have issues with vaccine supply. But there is no doubt at all that we are going to have a very nasty fourth wave of the virus unless we do something. And we've described to the Minister a number of the things that we think can be done. Bumping up local public health to the point at which public health can identify infections, identify contacts, and support all the people involved to isolate. Bringing back mandatory hotel quarantine and making it work, because you've never really had effective mandatory hotel quarantine in Ireland. And moving more slowly with indoor dining and foreign travel. I think there's a real risk to people leaving the country at the moment that they will be required to quarantine when they come back. And there's also a real risk that they will be required to quarantine when they arrive wherever they've gone to on their holidays. And that's not fair to anyone. And that's an awful imposition to put on someone who's just desperate to get a break. But the government has failed to give a really clear guidance on the risks and the benefits of different options. For indoor dining, we're still seeing restaurants negotiating with councils about access to the space outside their premises. That should have been sorted 4 weeks ago, 5 weeks ago. And it's certainly in the gift of the Department of Local Government to lean heavily on councils to move faster on this. A lot has been done, but there is more to be done. And we need to continue with the other stuff we're doing already. We need to continue with wearing masks. We need clear guidelines on ventilation. Certainly for schools coming back in September, we will need guidelines on ventilation, I think on CO2 monitoring, and we will need some funding for this. We need to continue with most of what we're doing. And the idea, rather than have an unending lockdown, which is actually what we've had, we've had more or less continuous lockdowns since March of last year, rather than having a lockdown, which at the current rate of progress will run till next Christmas. Actually do something to get a grip on this infection, bring case numbers right down, and start bringing this under control. And bringing case numbers right down has never been a policy goal. The policy goal has always been to reduce transmission. And I was listening very carefully to Philip Nolan's comments yesterday, and they're still talking about reducing transmission. But actually the aim is not to reduce transmission. The aim is to bring case numbers down. And bringing case numbers down is a much less ambiguous policy goal than reducing transmission. And we need to get on with it. We need to do it.
Yeah, we do. And I should clarify, when I was saying if not now, when, I prefer never, I meant never to get infected, not never to get back to normal. Because that was Boris Johnson's, like, if we don't let people get infected now, when do we let them get infected? That was how he was saying it. But I think this whole thing of letting it rip, which is happening in the UK, is meaning that people basically don't have choices anymore. So people are waiting for their vaccine. Some people aren't eligible yet for vaccination. So there's a huge amount of unfairness wrapped up into this. And I just wanted to bring in Helen Doak on this point, Helen. That the unfairness in this way, this timing, this strategy for relaxing the restrictions rather than the alternatives, which would have been relaxing restrictions in a context of low case numbers in the community, which we know we can achieve because we've achieved it before.
Well, exactly, Aoife. I mean, when we look at virus levels, it's not just the overall numbers, it's the fairness. How is it distributed in the population? And, I think there is nothing in the political discourse in England at the moment that even suggests that we're interested in fairness. But in Ireland, North and South, we surely are interested in the element of fairness. And vaccine is not about just about severing the link between the virus numbers and the deaths and hospitalizations, or weakening that link. It is about bringing the virus levels right down. That's what the vaccine, we're incredibly fortunate in having a vaccine, and we need to use it as a tool in bringing the virus numbers down, not just a tool in somehow weakening the link between high virus levels and lower than expected hospitalizations and deaths. So in terms of fairness, I'd pick out two groups. The clinically vulnerable people in our society. It seems extraordinary that we're willing to let the virus rip and say, you can just sort yourselves out. 18 months into the pandemic, we're not willing to protect you. We'll protect the NHS, which is there, after all, to treat the clinically vulnerable. But for some reason, we're not interested in the clinically vulnerable themselves. We're only interested in the service that's meant to serve them. So it's really not good enough. In terms of fairness, the clinically vulnerable need to participate in society like the rest. We can't just tell them to shield themselves indefinitely. That's one thing. Another is pregnant women. I think we've heard a lot about death, tragically, in this pandemic. Less about birth, which is the other great meaningful event in life, and the effect on pregnant women in this pandemic in so many different ways in terms of their experience of pregnancy, but also in terms of the protection of their health and the health of their babies. And we know that pregnant women are more at risk than other women of their age of severe COVID, and that their babies are at more risk of preterm birth or stillbirth. And that places a great load on pregnant women, and an unnecessary load, because if we were to suppress the virus, they wouldn't be experiencing this. Then they also have the very difficult decisions around vaccine. They've been recommended because of those risks to have the vaccine, but of course, individual pregnant women are aware that the evidence on safety of vaccines is as yet incomplete and still emerging, and they have to make difficult decisions about the risks as virus numbers go up to themselves and their babies, and the potential risk of the vaccine, even though to date the evidence is very reassuring. In terms of the long-term risk of infection during pregnancy to children's health and development, we don't know anything yet. We talk about the risk to children, but we also have to look at the risk to the unborn babies. So, again, these risks are unnecessary. In history, we tend to protect pregnant women and births because they're important to our society. It's our future generations. So we should be doing that again now. So, it's not to do, as you said, Eva, between the virus now, getting infected now and getting infected later. It's between controlling the virus and not controlling the virus. And in the interests of fairness, we need to control the virus. That's the only option, and we'll come to it in the end. But we'd like to come to it not via a whole lot more death, long COVID, etc., before eventually we learn those lessons.
Yeah, this pandemic has been and the virus and the infection and everything has been very good at discovering all of the inequalities in our society and widening those. And we've seen that, even just who is more affected, which groups had a higher burden of disease, a higher burden of economic problems caused by the pandemic. Everything, it seemed to fall again on the most marginalised, most deprived parts of society everywhere, including Ireland. I'd like to bring Jerry Colleen in here as well. Jerry, I think you wanted to talk a bit about this idea of equity and also, just the importance of reacting to the circumstances and changing your mind if that's what's necessary.
Thanks, Aoife, and also thanks Helen for, I think, spelling out the issues on the issues of fairness and equity. I guess this isn't my first time down this road, and in our field we split the benefits of our interventions into personal protection effects and community level protection effects. Okay, and as with vaccines, our most important measures, by far the biggest benefits come from the communal effects, that community-wide protection. When I protect myself, I'm also protecting you. And something that appeals to human beings is fairness. And one of the luckiest things I've been involved in was a real radical change in policy from WHO, where we just spelled out to them and to the global community, that it's actually those community level effects that are much, much bigger than the personal protection effects that everybody sees. Everybody perceives the personal protection effect very easily, but actually the big bang comes from the protection we all give each other. And so that was a total about turn for WHO that happened within 2 months of publication of the paper. I've never seen anything like it. What was interesting is that the community as a whole saw the policy in a different way to what I envisaged. And they referred to the old policy as the Titanic scenario, that you protect the women and kids, basically, and then everybody else drowned. So it actually went down really well with the community at large because it embraced fairness. Now, the other thing that was very encouraging about that experience was that I got to see courage at a policymaker, because it takes real courage to do a U-turn, okay? It takes real courage to be prepared to change your mind. And right now, our national health authorities are faced with one of the biggest changes in perspective they've needed to make in I think in living memory. And, I have to take my hat off and I have to applaud the willingness of NEFIT and the HSE this week when, their plan clearly came off the rails, when the real data left the 95% confidence intervals predicted for their plan and started to suddenly talk about things they should have been talking about a long time ago. But it takes real courage to now suddenly start talking about long COVID, about risks in children, about concern about schools reopening, and to really talk about those things. So, I think if we're going to ask people to have the courage to change their minds and make, some really urgently required changes in policy, then, I think we need a blame amnesty. Whatever happened before, just forget about it. It doesn't matter because we're all in the same boat as long as we get to the right place. So I'd say, cut people a little bit of slack if they seem to be changing their minds. But I'd also like to emphasize that this is the last time to change our minds. This is the last opportunity. There will be, what our government is planning to go ahead with at present here in the Republic differs from the English plan only in style. In substance, it's exactly the same. It says things are terrible. They're really going in totally the wrong direction. We know what's going to happen next. So we have a very clear choice. We either react and rein this one in before we lose 2,000 odd people. We see, tens of thousands of people go through long COVID, many of them children. When we go ahead with this, and when we make it worse by reopening international travel, by reopening indoor hospitality, we're saying to the persistently vulnerable people in our society, people like our friend Anthony, we're saying that you're expendable. That's what we're saying, okay? We're saying to children that your school experience, your growth is less important than a particular sector of our economy, okay? We're also saying, that that the risk of creating a vaccine evasive variant on our own soil is okay. And we're saying the risk of importing it from next door or somewhere else in Europe is okay. And that we're okay to go back to square one and start this all over again. So, it really is time to get away from this Father Ted version of pandemic response planning. Just make the right choice, because I can tell you, I can't speak for other people, but if our government goes ahead with this, I will not forgive. And as a society, we should not forgive, because we know what's going to happen. There's no question about this. So we know this is not a year ago. We know the same things, but we know them with much greater certainty. And, I would encourage our policymakers and our political leaders, please have the courage to change your mind. Because if you don't tell us afterwards that you didn't know.
Thank you, Jerry. And it's interesting there that you're talking about choices. And I'd like to bring in Ivan Perry here as well, because, the way Boris Johnson's characterization, which is very catchy, the if not now, when, is very catchy, but it does imply your choices between getting infected in the summer and getting infected in the winter. And that's a very depressing menu of options. I think it leaves people feeling very helpless. I think it leaves people feeling that this is just something that we just have to accept happening to us and that we don't have any meaningful choices. So Ivan, I thought you could come in here and talk about, the kind of choices we do have and what we can do.
Yeah, sure. And just to pick up on the point that Jerry has just made, I think we just need to be more honest and explicit in the choices that we are currently making. We know that we have a large population of unvaccinated people, and that we need to get the R value down to as low a level as possible. We also know that keeping the border open with the UK is probably adding 0.2 or 0.3 to the R value as we speak. If we open up into international travel, that'll add another 0.2 or 0.3, and if we open up indoor dining, that will also add to the R value. And these are choices that we're making, and we've spent almost all of the media time and energy of the past week talking about how we can open up indoor dining. We're not spending media time or political energy on how we can improve ventilation, how we can really invest in and support our public health teams to prepare them for the avalanche of cases that are coming. So I think we just need to stop the pretense that we can have our cake and eat it too, that if we make certain choices that bad things won't happen. We need to stop the pretense that we're not just pushing out the problem to the autumn. And I would just hope that we could encourage the media in sort of having this more honest and transparent conversation.
Yeah, I might just get back to Gabriel Scally briefly then, and then I might bring in Tomas Ryan. But Gabriel, I think people, listening to all of this and listening to everything that's been happening over the last year, I think it's very demoralizing for people. And one of the reasons people are happy to hear, or some people are happy to hear somebody like Boris Johnson saying remove the restrictions, is because they're exhausted with them and they don't see what they can do, and they kind of don't see an alternative. And I think, it hasn't, the message really hasn't got out there that this is something that can be managed in a way that is ultimately not so onerous on people. And, in terms of what public health is capable of, it's been interesting to hear a few people over the last week say that the idea of elimination has been debunked and that now Australia is showing that it's not possible. Whereas I would gladly swap places with somebody in Australia to have their experience of the last year as compared to our experience of the last year. But maybe you could address, just some of the things that can be positive, in the sense of the things that can be done to make this better, rather than it's not just something we have to suffer. This is a preventable disease and a preventable pandemic.
Yeah, I share your interest in what they've done in Australia and New Zealand and all these other places. And sometimes you see headlines, surge in cases in such and such a city, and you read that, it looks terrible, and they've mobilized and everything and shut lots of things down, and they've got a handful of cases. It's amazing how well it is controlled in so many countries. But you can only provide that level of control if you have it really suppressed and under control, and if you've your systems going. And that's what elimination means. I think people willfully sometimes misinterpret the word elimination. It doesn't mean that it doesn't exist. It means that you've got the systems in place to make sure that it doesn't make any number of your citizens ill and sick. And you do that always by a mixture of measures. And we don't, the phrase I hate is living with COVID. I hate that. We don't, I don't know of any other dangerous infectious disease that where you say, what do you don't say, oh, well, we'll have to live with diphtheria, or we'll have to live with measles, or we'll have to live with TB or something. That's not how countries keep their citizens safe and protect the health of their population. We could, of course, get this under control. And one of the interesting things just this month is I've been comparing the data from July 2021 and July 2020. And last July, we had tiny numbers of cases in the island of Ireland and 0 deaths for periods as well. And we had it in our hands to eliminate that and to keep it down. And it was thrown away. It was thrown away. That was our golden opportunity. That opportunity can be recreated again for us. We can get back to that situation. In fact, it should be so much easier now, shouldn't it? Because we've got vaccination on our side, and we need to use the vaccines to work for us towards a goal. And the goal has to be not opening pubs or restaurants or swimming pools or schools or whatever. That's opening these isn't what is important. Our goal has to be getting this virus under control, getting the cases under control, getting them down to 0 where we can. And there will be outbreaks and there will be surges, and we've got to deal with them. That's the way we deal with measles, for example, highly infectious, and Ireland has eliminated measles. The UK had eliminated measles, and it lost that status in 2016 because they didn't do that routine stuff of getting the vaccination numbers up and having the public health measures in place. So it is, and what we badly need is for the UK government or any part of the UK and the Republic of Ireland to actually give us a decent written strategy, and one that addresses all the things that are so important. Ventilation, and first of all, we need to fess up. This is an airborne disease, and we need everyone to understand that. And we need to stop the hygiene theatre that's going on. When I want to get my vaccination in the vaccination centre, I was no more out of the chair I was sitting in that someone was scrubbing it and washing it down and as if I was going to pass on the virus through sitting on a chair. And we're still we've got the wrong mindset. So we need a big public campaign on that, changing the mindset. If this was a waterborne disease, we wouldn't be running around trying to vaccinate everyone against a waterborne disease. We'd be making sure that the water wasn't passing on the bacteria or the virus or whatever, and we need to do that with air. So there's so many things we could be doing, and we really do need proper strategies laying out how we're going to get this virus completely under control.
Yeah, live with it by living without it. That's my preference,
Yeah.
And what we
can die with it. You could die with it, but you can't live with it. It's not a feasible concept.
And I think measles is a really good comparison because, yes, I mean, people look at the problem of COVID and they say it's too big a problem for us to deal with. It's everywhere in the world. Measles is like that, a highly infectious, deadly disease, but we have eliminated it locally. And none of us feels it in our daily life. It doesn't interfere with your daily life. And that's what we want to achieve. We don't want people to be under restrictions. We don't like lockdowns. We get things open by dealing with the source problem, not by just opening them. I want to bring in Tomás Ryan, though. Tomás, could you give us your views on what's happening in the last week in Ireland and the UK and the rest of Europe?
I think that one thing that needs to be acknowledged about the UK government strategy is that they are looking around the corner. They're looking around the corner well into 2022. And within that framework, they're choosing a strategy that is partly informed by science, but really based on value judgments, which are going to allow for a large amount of death, hospitalizations, and long COVID. In the Irish case, we are following not in intent, as Jerry Killeen said. We're doing it not in style, but we are doing it in content, and we're not really looking into 2022. But I would say more than that, we're not really looking into September, October, November. What makes us different from the UK is that we're a smaller country. The government feel the public pressure much more than they do currently in the British apparatus of state. Unfortunately, the effect that the public's opinion has on the Irish government doesn't really extend very far into the future, but it has a very large effect in the here and now. And most Irish people are not going to tolerate thousands of deaths going into fall and winter if we can prevent them. And they're not going to tolerate a huge amount, I hope, of long COVID, particularly amongst children. Now, this affects how we're going to deal with September and October, because we will end up having to have something like a lockdown. We're going to end up having to pull the emergency brake, which in itself is not what we want to be doing. And the later we push the brake, the more damage that it does. And I'm particularly concerned at a personal level as a parent for what this is going to look like for schools as we go into September. If we cast our minds back to the first week of September of 2020, we had most days that week, September 1st, 2020, had less than 100 cases a day in Ireland of the original variant of the virus causing COVID-19, not the Alpha variant, not the Delta variant, wild type SARS-CoV-2. We had under 100 cases most days that week, on average between 100 to 200 cases. And based on that number, there was, for want of a better term, a civic compromise that we would try and open schools and see if it would work. And there was this mantra from the government that the schools are safe, which we knew was not entirely true. And then when we came out of the Christmas surge, the government attempted to put the same narrative into place, even though we were having about 5,000 to 7,000 cases a day at the time. And there was a large pushback from teachers' unions, there was a large pushback from parents, there was a large pushback from ISAG and other commentators, because we were facing a situation where there was a large probability that most of the classrooms in Ireland would have a situation in those weeks where you would have someone with COVID-19 in a group of 30 children. Now, based on the numbers that Paul Dempsey showed us at the beginning of this webinar, we will be very likely facing that situation in September, that we'll be coming into a situation whereby there will be thousands of Delta cases a day in the community, with not very strong mitigation measures in place, as we did have in January, of course, in the general population, and putting all our kids into school with a Delta variant, which was not dominant in the population at all in the past school year. Now, we don't know what this looks like. We don't know how quickly this is going to spread through the classrooms, but it will, and it will partly based on the case numbers in Ireland. So we're not here to talk about vaccination for children. I'm personally very much in favor of vaccinating my own children who are not yet teenagers. But until we get to that situation where we are able to safely vaccinate children and teenagers, we do have a duty of care to protect a very large population of our under 18-year-olds in Ireland, 1 million people who have no influence on the policy decisions that we've been making, to protect them from essentially long COVID, which will affect, based on British data, about 10 to 20% of them. So I think that the reality is we are going to be forced into making very uncomfortable decisions for ourselves, either way, in September and October. And that when we're deciding what we're doing right now, we need to face those and to put those onto the table when we're thinking about how we want to manage the next couple of months.
Yeah, thank you, Tomás. I think it's very dispiriting to see the projections that Paul has, comparing us with Cyprus, which is similar in other ways in terms of, the population, the household size. Household size matters, of course, for transmission. If people are living alone, it's a lot easier to break transmission chains than people who are living in family units. And, so that comparison is rather terrifying. Hopefully vaccines, and they will and should, mitigate that somewhat. But I think we have to face up to the fact that we're coming into now talking about opening indoor hospitality with some, last minute ad hoc mitigations, where there are actually proper, sensible mitigations that could be done, and there's been plenty of time to plan for those. With regard to schools as well, and in general, I think one point that needs to be got across is that the quality of your face covering makes a difference. So we talk about face coverings, but there are good quality masks that will really filter out the small particles so that you are much better protected. No one thing does everything, and if it's poorly fitting, like Gabriel said, and you can see your glasses fogging up, then it's maybe not going to be the best, but it's still going to be better than nothing. But you can get a well-fitting mask, and there's the classification of the high quality. There's a certain nomenclature. So in Europe, they have FFP2 or FFP3, and those same quality masks are called N95 and N99 in the US. So basically they're blocking 95% or 99% of the particles, or KN99 and 95 if they're produced in, or if they're using the Chinese nomenclature. But these are all really good quality masks. And that's a simple thing that people could do for themselves. But I think this is something that should be just produced in bulk and distributed. I think it should be distributed to the school children. I think it should be distributed to the university populations as well. People who, for the sake of their education, are needing to go in and in hospitality venues and in workplaces, people should be wearing the high quality masks. And that's a simple thing that should be promoted, I think. And that along with ventilation, because of course ventilation doesn't stop you infecting somebody who you're right up close against. The mask, you should still need a bit of distance, the mask and the ventilation, and these are the things we should be talking about. That will be very effective in getting the case numbers down, and then we can do all the nice things that we enjoy. But it's really depressing that we're still in this situation. As Gabriel mentioned, a year on, we're in a significantly worse situation in terms of case numbers, a significantly worse situation in terms of the nature of the virus, because it is more transmissible and it is evading somewhat, slightly evading the vaccines. And there's the potential that it's also causing worse disease. And this evidence is accumulating and we're learning about it as we go. But we have let ourselves get into a worse situation when we have things that we can do, like an airborne virus. We can take care of the air quality, and we can talk about the public health measures that need to be brought in. I think I'll just bring in Anthony, maybe just to wrap up. We're just past the hour, because I think we were talking before. You've been presenting. You've been sending a letter to the Minister for Health. You've been leading so much in Ireland, in terms of what we really should be doing, and maybe we can finish on a note of what could be done and what should be done.
Well, I don't think I can finish better than by quoting the Taoiseach, who was interviewed on his way into Cabinet this morning, and what he said was there'd be twists and turns associated with COVID in the weeks and months ahead, despite rising levels of vaccination. Even though we are vaccinated, we have to be very careful, and it's vital that people adhere to regulations in outdoor and indoor settings. This is before the Cabinet meeting at which they're discussing whether to open indoor dining or not. Now, I don't know what the Cabinet will decide, but if the Taoiseach takes seriously what he said on his way in, then I would say the Cabinet should decide not to go ahead with it. But I do emphasise the costs that imposes on the hospitality industry, who have been gearing up for weeks to reopen 2 weeks ago, reopen next Monday, reopen whenever it is. And there are substantial costs in staffing, in stocking, and many other things, which are falling very unfairly on the industry. The industry is trying to do its best. They're not public health specialists. That's not their trade. That's not their training. But they're generally really, really good at following clear guidance. And the challenge for them is they haven't been getting it.
Yeah. And they've been led to believe that multiple times now that things would be opening without the other preparations being put in place by the government. So anyway,
twists
I think that's
and turns indeed.
Twists and turns. So I think we'll finish there for today. Thank you, everybody, for your participation. Thank you to everybody for listening. And I hope you found that useful. So it isn't a matter of now or later that we get infected. We can choose never, because this is a preventable disease and we have tools at our disposal to prevent this. And the vaccines plus the other mitigations are going to mean that we can make things safe for everybody again, and we can enjoy a good quality of life, and we don't need to let people suffer in the interim. So thank you very much to everybody, and see you next time.